In this podcast episode, Dr. Karan Rajan, a surgeon and medical educator, discusses various aspects of digestion, gut health, and sleep. He provides insights into the science behind digestion, the role of the gut microbiome in overall health, and the impact of sleep on mood and well-being. Dr. Rajan explains that holding in a fart can lead to the release of fart fumes through the bloodstream and exhalation, emphasizing the importance of letting it out. He also delves into the process of digestion, highlighting that the stomach is not the sole organ responsible for digestion. He explains that digestion primarily occurs in the small intestine and involves the interplay of various organs such as the gallbladder, pancreas, and liver. Dr. Rajan also dispels the myth of a one-size-fits-all approach to gut health, stating that individual DNA determines the amount of sleep needed. He discusses the rise of conditions like IBS, gluten intolerance, and food intolerances, attributing them to factors such as diet, lifestyle, and the gut microbiome. Dr. Rajan shares his perspective on probiotics, prebiotics, and colostrum supplements, emphasizing the limited effectiveness of over-the-counter probiotics and the potential benefits of probiotic-rich foods. He also discusses the impact of sleep on mood and overall health, debunking the 8-hour sleep myth and highlighting the importance of individual sleep needs. He explains the role of clock genes and proteins in determining the required amount of sleep for each individual, emphasizing the need to understand and cater to one's unique sleep patterns. The conversation shifts to the gut-brain axis and the influence of the gut microbiota on mood. Dr. Rajan discusses the presence of serotonin in the gut and its role in digestion, while also highlighting the connection between the gut microbiome and neurotransmitter production. He shares insights from studies involving fecal microbiota transplants, demonstrating the impact of gut microbiota on mood and behavior. Dr. Rajan also addresses the impact of napping on mood, explaining the concept of sleep inertia and the importance of understanding individual sleep latency and nap duration. Dr. Rajan provides a protocol for napping, emphasizing the benefits of a 90-minute nap for memory consolidation and overall refreshment. He also discusses the 3-2-1 rule for sleep hygiene, which involves stopping eating 3 hours before bed, stopping drinking 2 hours before bed, and avoiding screens 1 hour before bed. He also suggests adding a 10-minute buffer for coffee consumption before the 3-2-1 rule, considering the half-life of caffeine. Dr. Rajan addresses the potential impact of external factors such as moon phases on sleep, acknowledging the potential influence of external light sources on sleep quality. Dr. Rajan explains the importance of protecting one's hearing, as the hair cells in the ears are essential for transducing sound. Long-term exposure to loud noises, such as in nightclubs or concerts, can damage these hair cells, leading to hearing impairments. He also warns against plucking nose hairs, as it can increase the risk of infections and microabrasions, especially in the danger triangle area of the face. The conversation delves into the topic of pain management, with Dr. Rajan highlighting the power of understanding the physiological reasons behind pain. He explains that explaining the source of pain to individuals can actually increase their pain threshold and lower their pain perception. Additionally, he discusses the impact of stress on pain perception and the importance of mindfulness in managing pain. Dr. Rajan emphasizes the impact of screen time on eye health, particularly in the context of the modern digital age. Prolonged exposure to screens can lead to eye strain and fatigue, affecting the muscles that help the eyes focus on nearby objects. He recommends taking regular breaks from screens and defocusing the eyes to stimulate the parasympathetic nervous system. The conversation addresses the issue of cognitive decline, particularly in relation to Alzheimer's disease and dementia. Dr. Rajan stresses the importance of lifestyle factors in delaying neurodegeneration, such as adequate sleep, regular exercise, a healthy diet, and social connections. He also highlights the role of stress in accelerating cognitive decline and the need for positive emotions, such as awe, to counteract the effects of stress. Dr. Rajan discusses the physiological impact of chronic stress on various organ systems, including the immune system, skin, gut, and heart. He emphasizes the need to recognize and manage stress, as well as the benefits of experiencing awe in promoting well-being. Awe, defined as a profound sense of wonder and inspiration, can be found in new experiences and can have a positive impact on overall health.